Hello and welcome to the first Meet Our Scholars interview where we'll be meeting and talking to our dental scholars. This is a new series from Church Health Scholars Program where we're just trying to introduce the scholars and the scholar experience. So they'll be discussing some of the things that they've gone through, their own journey, and some of the things that they're learning over here at Church Health. So we'll introduce them in a second. We'll go through some questions with them, and then we'll wrap up the webinar today with talking about the application and the application timeline. So with that, I'd like you guys to meet our dental scholars. Sarah, do you want to go ahead and introduce yourself first?
Yeah, so I'm Sara Owen. I'm a dental scholar at Church Health. I graduated from Christian Brothers University in 2019, and I've been at Church Health ever since.
Of course. Hi, everyone. I'm Mark Massey. I am the other dental scholar with Sarah. I graduated from Rhodes this past May. I've been born and raised in Memphis. So I've been here my whole life, but I'm really excited to have this opportunity to be at Church Health.
Great. And then we also want to make sure your supervisor is joining us today. So I will go ahead and let her introduce herself as well.
Hi, good morning. I'm Tammy Clark, and I have been a dental manager here and serving the community for 11 years and looking for another 11 years to come.
Great. Well, welcome everybody. Thank you for joining us today. So before we get started, can y'all want to talk about yourselves a little bit more, maybe share a little bit of your story, maybe where you're from, where you guys plan to go next for the scholars, and really what brought you guys to Church Health?
Yes, so I'm from Dyersburg, Tennessee. It's like 2 hours north of Memphis. I'm planning to go to dental school. Mark and I are both in the application process. He's already gotten one interview, so that's really good. Sorry, my light will go off. And yeah, so grew up in a really small town. Got involved in dentistry really during high school when we had to go and do a service learning project, and kind of fell in love with it then and kept in touch in college with it and got really involved in a club called Best Buddies and also fell in love with the special needs community. So I kind of wanted to put both of my passions together. And so my ultimate goal now is to work in dentistry with patients that have disabilities.
Thanks for the shout out there, Sarah. So as I've mentioned, I'm from Memphis and been here my whole life. I got into dentistry just because I knew throughout high school that I wanted to be in the medical field, but I didn't really know how that would look like. I knew that, I wanted to be in more of a clinic setting, wanted more regular hours for kind of more family-based schedule. And then, so just thinking about those things, and one day my personal dentist asked me to shadow her. And so when I did, I just absolutely loved it. I found everything so interesting, all the procedures, how she got to interact with her patients, the type of patients she got to work with. I was like, this is the type of medicine that I want to practice. So then going forward, I knew that, well, before I want to try to get into dental school, I want to work in the field to make sure that I know that this is what I want to do. And I know for a lot of people in dental, it's kind of hard to find opportunities where you can actually get hands-on experience. I think with medical, you can almost go to any hospital and find a position, but with dental, it's a little harder. So Church Health Scholar Program is really unique in that sense that me and Sarah both get lots of hands-on experience just by, showing up every day and working. So both of us, I think, are very fortunate to have this opportunity, and I'm glad that, we're able to gain this experience.
Thank you, Mark. Thank you, Sarah. That's really cool. I especially like what you say about getting the hands-on experience and it being hard to find hands-on experience for this kind of phase of your career before dental school, because then usually you're at that point then kind of already moving toward a separate career within dentistry, or you have to get some kind of other credential or experience and then moving on to a dentist going to dental schools and then a kind of a next step. So with Tammy, I would also love to invite you to address that question as well. We know that the supervisors here have a really deep relationship with the program and with the scholars and kind of what they're learning. So with that, yeah, can you tell us a little bit more about yourself and really what brought you to Church Health?
Okay, yeah, so I came to Church Health, like I said, going in my 11th year, and I came with a background of internal and family practice for 20 years. So this was a new world to me, but I knew I was getting pushed by my faith to learn something new, and boy, did I sign up for something new. So dental has been a challenge in my career as far as me learning all the ins and outs of how dentistry works. It is a totally different world compared to medical, but it has been a great journey. And I hope that everything I have learned over the last 11 years that I put back into the scholars, I hope that they're like learning not just the clinical, but overall how dentistry works, but more so about making sure that their work environment is a healthy culture, as well as the impact that they're making on the patients that we treat that are underserved. So it has really been a true journey for me, and I am blessed every day that I walk through the door that I'm able to be here.
Thank you. Thank you, all of you. So with that, yeah, we'll move into some more of the more detailed questions. So maybe before we do that, would somebody like to talk about the dental department at Church Health, what it is y'all do, who are the patients that you serve?
I can go ahead and tackle this one, and they can correct me if I misspeak, but the dental department, we have a staff of just over 30 people. We have 5 dentists on hand. I think 4 of those are pretty much full-time, one of them's part-time. She also works at a private practice. I think right now we're probably seeing somewhere between 350 to 400 patients a week. So, I mean, we have quite a large practice. We have 24 operatories. So as you can imagine, we're serving a large pool of patients, and these are patients that essentially are working but don't have insurance. So it's a patient population that is kind of vulnerable, especially in areas such as dental care that we're able to provide healthcare for. Our staff is great. We have great camaraderie, great teamwork. I think that's some of my favorite parts of working at dental is just who I get to work with every day, who I get to talk with every day. Even though we are pretty busy and they only shut down momentarily for coronavirus, it's really unique to kind of see the challenges that a dental clinic must face while working in a pandemic, but also rewarding to see that we're still able to do what we do and make impactful moments for our patients despite.
I would add that we're also, I feel like when you talk about nonprofits, you think of kind of maybe hole in the walls or just small clinics that can do minimum because maybe they don't have the funding or whatever your reasons. But that's not the image that Church Health paints. Church Health in a whole is top of the notch, elite healthcare. And our dental clinic is nothing less than that. Our doctors are amazing. They're so caring, and they also do really good work. We do fillings, we do extractions, but we also do endodontics. We do root canals every day. We place implants. We have specialists that come from UT to see our patients once a week, which is huge. So we have surgeries with that, and just other things that totally give our patients a complete elite care that you wouldn't necessarily assume that comes from a nonprofit. So with being a scholar, you get that experience of top-notch care and hands-on in all aspects of dentistry. So it's awesome. Here's my light.
Yeah, Sarah, you still have you keep having that light going on and off. So yeah, you keep waving your hand. No, I really like how you guys put that, and I think you painted a really good and kind of holistic picture of really what Church Health as a whole aims to do through any of our services, especially through the dental department. Tammy, before we move on, did you want to add anything to that?
No, actually, I think they covered it really well. I'm very proud of the information that they have. It makes
Good.
them, yeah, they're doing great.
Yeah. So with that, that kind of sets us up for our next question. So you guys have kind of talked about what dental is, what they do, and how they add into Church Health in a very articulated way. So with that, what is a scholar and what is their role within all that?
I feel like Mark and I can both add to this one, definitely. So in my eyes, like a scholar position is just a fantastic way to attack your gap years, maybe multiple or just one. It's basically like a service learning fellowship, I guess is a way to put it, where you're day in and day out, getting hands-on experience and making sure that this is what you want to do for the rest of your life, and also learning ways to give back to your community and being in a faith-based organization that also builds those aspects of your life, and just ways to improve yourself in that way as well.
Yeah, no, I agree with Sarah. And the kind of way I like to look at it is almost being kind of a servant, not just to Church Health, but to the overall community as well. We're here to essentially show up every day and say, hey, what needs to be done and what areas can I, either help the clinic or help our patients out. So, I think not only are we able to serve the community, though, Church Health is serving us, because we're giving, invaluable experience, not only in being hands-on with patients or working chairside, but also seeing every operation from a dental clinic standpoint, whether it's working the front desk, working sterilization, seeing, how we interact with the laboratories that make, crowns or prosthetics for us. So, I mean, it's definitely a two-way street, but it's all about, learning and, being a servant to both Church Health and the community.
I'll add on to that as well, is you see what all it takes to make everything work and how much effort is put into one single person. And that's been really special to be a part of. And we just have an awesome team that we learn so much from every day. So it's a priceless experience.
That's really cool. Again, I like how you both are articulated that. I think some of the key words I definitely picked up in there were servant and giving back, this idea of exploring and learning, and then just a lot of experience and hands-on, and just it sounds like you all are gaining some understanding and compassion, both operations and just kind of what it takes to kind of have that good bedside manner and working with patients and people. So with that, Tammy, would you like to address the same question of kind of what is a scholar and kind of what is their role within the dental department, and how does that kind of change since you've had such a long experience with scholars?
Yeah, so one of the things that I know when we're doing the interview process that we kind of look for is this program is really set that they want clinical, right? Everyone wants to come in and just like, let's hit the ground running and let's learn the clinical and get chairside and stuff. But I think what you're hearing is that when we bring you on, we definitely are going to give you that. And we know that ahead of time, but we also want all areas to be covered. We want everyone to understand, our scholars to understand that if you don't have a strong front desk, you're not going to be successful. If you don't have great teamwork and you don't work on teamwork on a regular basis, your hard days are going to be even harder. We definitely have hard days, but I hope our crew and dental scholars will tell you, as you've heard, we work really hard on those days, but they're easier when you have a great team. So I hope that overall, like I said earlier, that they gain is not so much clinical, because we know that this program is going to give them the clinical that they need, but that they're also seeing the overall of of what it takes to run their, if they go into private practice, what it will take to do that. And then focusing on the culture of being in a healthy environment. But also the biggest part for me is the impact that our patients give to them. When they are open to feeling what the patients have and what they're doing for them, those are the wow moments for me that I get to hear from them about. So it's an overall, and like I tell every scholar when they walk out the door, I hope to see you soon for a volunteer time. I get that. So, I mean, like I said, I'm 11 years into this, and my first scholar is due to come back in 6 months to start volunteering. That's what I want, is for them to know the importance of the community work. And if you're not able to do it full time, at least volunteer during, your lifetime and wherever community that you land in.
I think that's amazing, having this, being kind of in the middle of this cycle and into the point where you're seeing scholars come back for the past couple of years as we've run the program. And you guys have heard me kind of joke about it, is we really don't want to let you guys go. Right. And people think I'm really not serious. And it's like, no, we really do consider scholars family. We hope that they come home, especially when they're ready to serve and step into their professional calling. And so I think that's a really great kind of story and a way to share that. And I think that also kind of leads into our next question. So all of you, especially Mark, you really talked about this concept or the idea of camaraderie. And so I do know dental has a great culture to kind of work and teamwork and a lot of team building. And so it's a really big focus for the dental team, and that's awesome. And so you all spoke about this camaraderie, the idea of teamwork and loving dental and who you work with. And then Tammy, you talked about how that relates to, it sounds like they're learning life lessons through these relationships. So really, who are some of the people that you interact with on a daily basis, and how can you talk about those folks?
I can go ahead and start on this. So for me, the easiest way to kind of break this down is, in general, as a whole, dental's kind of broken down into two houses. We have our Hufflepuffs and our Gryffindors. So I'm on Team Gryffindor. So each of our houses, then we break down into pods based off the doctors. So we have, for me, I've been spending most of my time so far with Dr. Fergus. So we have him, and then we have two other assistants, Benita and Becky. And then we have hygienists that will help us out, whether it's, we have Elizabeth, Joanna, or Tori. So those are kind of the team that I am most directly working with right now. And I mean, if you think about it, those are the people that have trained me to do everything that I've done so far. I didn't come into this position with previous clinical experience. So everything that I've learned is what they've been able to teach me. A lot of the things that I've done, I was doing for the first time on a patient. So it's actually really cool for them to see my art from when I first got here to where they can see me or what I can do now, rather. But I mean, I love working with Dr. Fergus. I kind of call my work dad. I have my work sisters, my work mom. So I think the staff as a whole kind of is welcoming the scholars, and they're going to nurture them and call them as if they were one of their own. So it's actually a really cool experience for sure.
Cool. And I think that's really neat, because you just kind of started talking about learning from the different staff. And earlier y'all talked about learning from the providers a lot. And so it sounds like you're learning from more than just the doctors and the providers, but you really are learning from the hygienists and the RDAs and the front desk staff. And so everybody is kind of a teacher to a scholar, is what it sounds like. Would you guys kind of agree with that?
There's something to learn from everyone, whether it's a different way of doing something or just, you have a question on the spot and you need some help. I mean, everyone's ready to pitch in and really help you nurture.
Cool. Would anybody else want to kind of address that question? Maybe talk about who are the people you interact with on a daily basis, maybe other patients or other staff members?
Yes, so definitely on a daily basis, Mark and I as scholars interact with patients every single day. So our main role is like a support system for the clinic. So if one assistant calls out in your pod, you're going to cover that assistant that day and be with that doctor. I'm on the Hufflepuffs. I have two amazing doctors that I get to work and learn from every day. They both have different techniques and styles that they do things. So you cater to each doctor. So that's a cool thing to learn, is like remembering steps and process that one does different than another doctor does. Challenging, but also awesome. So we get to see a lot of the same procedures done in different ways, which is cool. And then, yeah, our patient interaction is very high. We go from pre-oping a patient to helping treatment plan, figuring out what's going on, um, reviewing their medical history with them. Sometimes they're having a bad day and they just want to talk about their bad day before they get their fillings. So you're also a listening ear and maybe giving helpful advice, finding other resources within church health to help them in other areas, maybe not just their oral health. And so our patient interaction is very high every day, and it's awesome.
Okay, that's really cool. I know, yeah, and dental definitely has, like you said earlier, Mark, hasn't stopped since COVID started. So Tammy, my next question is actually for you. With the scholars being in two separate opposing houses, does their kind of competition between Gryffindor and Hufflepuff, how does that play into their work styles and working together on the floor?
Well, obviously this year's Harry Potter theme, and dental is always excited about rolling out a new theme. So yes, we do split our scholars into whatever team we're hosting, and we got the Hufflepuff and Gryffindor. This is a huge part of how we work on our team building throughout the year. And it's okay to be a little competitive. Sometimes it brings a little like hustle to your job, and we find that it really works well. It's a happy environment. It's always fun when we compete. And so Sarah and Mark have done a great job with supporting their teams, but also they don't always just stay in their house. They'll linger into the other houses depending on what's going on that day. At the end of the day, we all work together, but having the houses definitely has been fun this year. And the house point systems really do motivate people during their work to stay focused. So yeah, we definitely love them being in separate. The fun part is that 6 months into their program, they will switch houses. So come January, they will switch homes, and then they will get that experience with the other house as well. So it's definitely fun.
I think that just speaks more to the well-roundedness or the well-rounded experiences that the scholars get in dental, right?
Exactly.
Right. So you guys kind of talked about how dental has continued to serve during this time of COVID. So how has the scholar role changed, if at all? And how has dental services changed with COVID?
I'll start on this one. I will say that since COVID hit, we did not miss a day of work. We have been open, our doors have been open as church health as a whole this whole time. And as a dental clinic, we may not have been able to do cleanings, our hygienists had to shut down, and restorative work, but we kept an emergency clinic rolling the whole time. Dr. Oxner did a great job heading that. And then also, dental is about flexibility and adapting. So half of our team, headed by Dr. Hodge, our director, basically came up with, innovated, and then worked through kinks with our COVID testing drive-through as well. And they did an absolutely amazing job with that. Dr. Hodge is just awesome in general, but she was so creative during that time and so supportive for our team when we needed it. And it kind of felt like everything was down in the world, and then you come to work during a pandemic and your spirits are lifted. I mean, it was just an amazing experience, and it still is an amazing experience. We started our scholar term, Mark and I, and they're like, man, I hate that you're having to come in during COVID. You know, our team building's so different and all this stuff. But at the end of the day, Mark and I are getting an experience of working in healthcare during a global pandemic. when maybe a lot of our peers aren't getting that option, which is sad but true. And it's all to aid in maybe what is to come and just an awesome learning experience. So Church Health has really provided during COVID-19 like none other, and has always kept its doors open, and dental has done the same.
Yeah.
Yeah, I would say that the name of the game so far is just PPE. Like Sarah said, luckily me and her have still been able to have this experience despite the challenges. And Tammy can also contribute with the struggles of the PPE. But I mean, looking back on the last several months and seeing the work we have done, it would be, incredible to think of what if we couldn't provide that work that we did. Just seeing the types of things that our patients need, whether it's they have emergencies where they need something fixed or just their general treatment plan. That's important work that has needed to be done. So I'm glad that we've been able to find ways to be adaptable to still provide this care regardless of the challenges. And so, I'm thankful that we've been able to still be able to do that for our patients.
Most definitely. And I know that the dental scholars have not been the only scholars involved with kind of on the front lines of COVID as well, and working a lot with COVID. So with that, I know we just kind of got talked about COVID, and that's definitely a kind of a challenging piece. But kind of beyond that, what have you found challenging during the program or your experience? What's just been a challenging moment for you, and what have you learned from it?
I mean, for me, a lot of it was I was coming in brand new. I didn't know the difference between a 150 and 151 forcep. I didn't know anything really outside of, a filling kind of looks like this, but I don't know the steps. So for me, when I first got here and I started kind of shadowing a little bit more, I was really trying to pay attention to the assistant more than the doctor, because I'm not going to be the doctor yet. I still have a way to go. The job that I'm going to be doing is assisting. So I was really just trying to, kind of take mental notes. Oh, this, we give them this, then this doctor likes this. And, at first it's, really overwhelming. There's a lot of instruments in dentistry, especially, since we've been helping out with our periodontic clinic as well as UT. They have a lot of instruments. And again, didn't have any experience there either. So, you have to be quick on your feet. You have to be able to learn, and you're going to make mistakes. There's going to be times when, your dentist is going to tell you, no, we don't need this, or no, don't do that. Because, you still have to provide great care. There's no sacrificing care for me to learn. But it's also rewarding when at the end of the day, your doctor tells you, hey, you did a great job assisting today, or something like that. So it's challenging, but rewarding.
Yeah, that sounds like a lot of the work that scholars and Church Health in general does. Sarah, did you want to add into that?
Yeah, this question to me is a little tricky, because our group and being a scholar in dental, you have such a support system that any challenge you can think of is overcome so quickly because of teamwork, basically. So, I mean, starting out, I've always, I've always been in school and playing basketball. So that took up my time, definitely. So working a 40-hour work week was super challenging for me. I thought like college was hard. Like you get up for 5 a.m. practice and then you go to class, but you take naps during the day. I take a nap at 2 o'clock every day. So, a huge like switch was working a 40-hour work week. You're getting up, you're here by 7:20, 7:30. You're going home maybe 5:15. Perio days, we probably go home at 6. But yeah, just your body adjusting to that, and like entering the work world and experiencing that, and then trying to balance like a home life as well, and just time for other things. That was probably the biggest challenge for myself.
That's interesting. I like how you both bring up either kind of these professional challenges, but also these personal challenges. So I think that's really neat. And Tammy, as they're talking, I can kind of see the pride coming out of from you. Would you like to speak to any of the challenges that you observe, not necessarily from these two, but just that you see scholars having when they first come in, and what are some of the ways that they adapt to kind of this new style of work?
I'll come off what Mark was talking about. I think at first when you come in, it is overwhelming when you see all the moving pieces it actually takes to do a procedure. Basically, I've said this time and time again, and they've heard it. It's little mini surgeries every hour that they're actually doing. And so I do see scholars come in. They're not the first that come in that get a little overwhelmed with like, this is a lot and I don't want to mess up, because you have that expectation of like not wanting to mess up, right? But things are going to happen, and we definitely want to support them. We always make them feel comfortable. We just don't throw them chairside. We let them go at their own pace. But most of the time, our scholars are amazing. They're like sponges. They absorb everything. Sarah and Mark have been those two examples of like, they get it one time and they're going for it. And so definitely overwhelmed with the workflow of an RDA and a hygienist as well. Can be a little, it's definitely one of the highest ones that I see when they come in, is that this is a lot, and they get the bug eyes and like, what am I going to do? And then I think the second piece of that, off of what Sarah said, it is a transition sometimes for our scholars who, like Sarah said, needed to work a structured 40 hours a week. But I promise you, Sarah and Mark, I have to sometimes kick them out of the clinic. I'm like, it's time to go, because they're wanting to prep for the next day, or they're reviewing patients' charts, and their work ethic is awesome. But like I said, some days I'm like, it's time to go. Let's go. Are we done? Are we done? So I do kind of hustle them sometimes, but I'm very thankful that they have that work ethic, that they're here to learn, and they take every opportunity to do that. And yes, I'm very proud of them as I'm sitting over here smiling at them.
Okay. And then, no, and that's great. Yeah, you should definitely be proud of them. I mean, every year our dental scholars do an amazing job. And so getting the chance this year to know Mark and Sarah has been fantastic. And then Sarah, so my next question I'd like to gear toward you, since you were talking about kind of challenges with school and just kind of adapting life. So how do you feel school and your experiences prepared you for working at Church Health?
School and my experiences definitely revolved around teamwork, because I played basketball all 4 years at Christian Brothers. Go Bucks. And I mean, it's the same camaraderie that you have at work that I experienced being on a team. I mean, they go hand in hand. It's not like a one-man show. I mean, we all put in effort, and in the end, it's better for our patients, and they get the care that we want them to get. So that's definitely a huge takeaway from my life experience. Transitioning into Church Health has been that. And so, yeah, I'm thankful to have a great education to help me towards dental school, and then those experiences helping me in my day-to-day work here at Church Health as a scholar.
Yeah, and I think school and my college experience in general kind of really geared me for what Church Health requires from you. Academically, I felt like Rhodes, requires high levels of excellence, all 4 years, which is what Church Health does. But also, I coached women's basketball in college, which that's all about teamwork. It's all about, from my position, it's all about what can I do to make the team better? How can I make myself available? I mean, that's the role that we play here at Church Health, whether it's, every day we're showing up, hey, what can we do? And that was what, kind of my goal was in college, was whether it's, with basketball, or I also was one of the leaders in a Special Olympics club serving that community. So, I mean, if your college, experience is all about serving, then you'll be just fine at Church Health.
That's really cool. And I think that's interesting that you're both talking about specifically past kind of life experiences, especially in sports and teamwork, and how that's playing as much of a role as your academics. and probably not just in working at Church Health, but preparing for dental school and kind of moving on to your all's next steps. So with that, I'd be really interested, and I'm sure our audience would be, in kind of hearing what are the things that you're learning as scholars? What are you taking away kind of specifically from your experience?
I think kind of hinted on this earlier too, but just all the steps that it takes to run a dental clinic, whether it's from as soon as the patient steps foot in the clinic at the front desk, whether it's calling them the day before, hey, you have your appointment for this coming up, to bringing them back, pre-oping them, to, you know, helping the dentist perform the procedure for that patient, to, you know, giving them the post-op instructions, setting their next appointment, you know, seeing them on their way out. You see every step of the process. And then, I mean, in between each of that, you have every, you know, skill set that is required, whether it's having great patient interaction at the front desk, you know, being very cordial to them, being understanding or patient if they're upset about something, to the clinical side of, all right, this is the procedure, this is what the doctor wants, this is the instruments that are needed. And, you know, that's expected that you have all that ready before the dentist even walks into the room. So, you know, you have a lot of responsibility on your shoulders, but, you know, from what I've learned in the last several months, it's, you know, I would have never thought I would be at this point this early, but, you know, here we are, and you just kind of learn as you go.
Yeah, definitely as scholars, we learn chairside assistance that we'll use for the rest of our lives, hopefully. And I mean, a lot of motor skills that you'll learn in school that we get a one-up on, taking impressions. Mark and I have practiced many times on each other, pouring up models, anything in the lab like that. Our providers always take time to show us things, show us what they learned in school, best ways to do things. But also just, I mean, you're soaking in what level of care that you want to give to your patients in the future. And how to do that and what all it takes to do that. So, you know, we're seeing an elite level, we're soaking that in, and hopefully we give that same elite level in the future to our own patients.
So with that, I actually have a question for you guys, and I know this may be a little bit of a curveball, and I know that every year the scholars come, they're always preparing for school and next steps. But I didn't realize how thoroughly you guys did it until I think, Mark, you came in during new employee orientation. Would you guys mind talking about this tooth jar? Is that something you guys can describe really quick?
So we have a scholar jar. It's really gross. We have a scholar jar. So when you go to dental school, they like for you to, actually it may be required for you to bring so many teeth of each set, molars, premolars. And so when we have extractions, we're allowed to keep them to further practice on when we get into school, because you don't just hop right into a patient's mouth. You know, you simulate by trying on real teeth, but outside of a patient. So one of the benefits of being a scholar is that you kind of get to build up your collection as you're here, so that you can take them on for future practice in a school. It kind of really bothers Tammy. She has probably more to say about this than I do, but she may work and manage a dental clinic, but that does not mean that some stuff doesn't get to her.
So I think this is a great Halloween themed topic for dental. Tammy, did you want to add anything else into that?
Yeah, the teeth thing is a seller. They love those teeth. And let me tell you, I make them take care of them. Sometimes they leave them in little cups in the sterilization room, getting ready to put them into their special teeth jar. It's very creepy. Yeah, I love dental, but I always radio. I was like, someone needs to put their teeth up. Like, it's kind of weird and odd to say, but in dental, it's what we do. It's the norm, but talking about it out loud is probably a little freaky to most. But yes, they have their teeth jars.
I just remember when that came up in the middle of new employee orientation, and we just all kind of stopped and went, what? Looking at Mark. So, no, yeah,
I
thank you
mean,
for explaining that.
it's quite the impressive collection, I will say so far. I don't know. I haven't counted, but I'm sure we probably have 70, 80 teeth in there right now. So it's pretty impressive.
All right, so it's about 10:40, 10:45-ish. So we're gonna start transitioning to closing out. So just a couple more questions for you guys, and we're gonna talk a little bit about the application. If anybody has questions at this point, feel free and put them in the chat and we'll address them in a couple minutes. But kind of inviting other people to the program. Who should look into joining this program? What would y'all say about that?
I think I kind of hinted to this earlier a little bit, but someone who's willing to serve someone, it's not that you have to have all this dental experience, but you do need to have experience, working in a team setting or serving others. You need to be an individual who's going to work hard. I mean, it's not easy. We're a very busy clinic. We serve a lot of patients, so it's always go, go, go. But it's also someone, if you feel very good about yourself, helping others, or you get rewarding feeling, doing something challenging, then this will be a good position for you.
I'll also add that as a dental scholar, like building on Mark, it's a hard day to day. It's a lot of work and a lot to take in. But you figure out if you're passionate about it or not. So, now's your time before you get into school and invest in a future. This is a perfect opportunity to make sure like this is what I want to do and this is exactly like who I want to serve and in what ways. So it's an awesome opportunity for that as well.
Tammy, did you want to add anything into that?
No, actually, I think that they answered that really well. That's usually the type of experience the scholars are looking for when they apply. Obviously, we're going to take the best of the best when we do our interviews for our scholars. We want someone who is really like wanting, like Sarah said, their heart's there, but actually coming into this program, you're really going to know if you're really ready for this. And kind of a little fun fact about Sarah, she actually came to us through internship. A program that runs through a semester where she comes and serves 8 hours a week, and 4 of those hours are intern hours actually on the clinic. And I think that that's a great opportunity too for people who are really not quite sure if they want dentistry and think that they do. That will definitely give them a little taste. But then once Sarah experienced that, I think her heart grew even more fonder and she applied for the scholar position. So yeah, I think that it's a great gap year to grow clinically, because obviously when they get into school, they're going to be way ahead of the game when it comes to clinical and terminology and treatment planning. So I think that there's some great opportunities taking that 1 year before you go into school for sure.
And I think that's a good piece to point out, is that a lot of our dental scholars, especially, I love bragging on them, is we hear a lot when they get to school that they finally feel like they're really getting into some new stuff around year 3 is usually what I hear. And so that's a really good kind of thing, because it does mean that you guys are getting the experience. Tammy, I also think that was a really good piece of advice you kind of shared, is the idea of internships. And so if you have interned with Church Health, there's probably a greater chance that you have of getting into the scholar program, simply because you already would have worked with that supervisor and that team and are aware of what they do and familiar with the mission of Church Health. So to anybody listening, if you are interested in Church Health, if you're not graduating this year but think you might be interested in scholars, definitely look at doing some of the internships. They are, like Tammy was saying, they're about 3 months. About 8 to 10, 12 hours a week. And so you work out schedules, super flexible with supervisors. There's some remote possibilities, but it's a great way to see if you're really interested in what you're wanting to do. And then if you transition from internship to scholar, then you're doing kind of the next level of work with that group. So with that, one of the questions I wanted to close on with the scholars was, what advice would you share with potential candidates as they're applying to the program?
I'll hit on like what Tammy said, advice that I'd give to people trying to get in the scholar program, individuals applying, would be in your time. I mean, I can't remember when exactly the application closes, but in that time, come and volunteer. That gives you just something else to talk to in your interview. Learn about church health, learn about our mission, learn who we serve, and all that we do, all of our parts of church health, so that, you're able to relate with the people interviewing you, and being able to connect on that level of our mission and what church health is here for.
Yeah, I think I have two sets of advice. Number one being, for me, I came in completely new to church health. I didn't really have any connections. So applying early, I think, was very beneficial for me. I applied way before the priority deadline. And I think that's a good way to get a leg up. But also taking the application process very seriously, because I mean, it's a pretty intense application process. You have to have letters of rec, you need to have personal statement, you have to answer some questions. So it's not exactly the level of the dental application, but they do take some things from it. And, during your application process, whether it's your application itself or the interview, both Tammy and Dr. Hodge are, observing you, and it's almost like a mock interview for dental school itself. The types of questions they ask, the types of things they are looking for. So, you take it seriously, and afterwards, if you do get the scholar position, they're going to take what you did on your application or what you did in your interview and say, all right, this is really good. We can go forward with this, or, hey, you need to work on this area. This is some advice that we would give you for your dental school application or your interview. So it's, a very interesting but beneficial process.
All right. Yeah. Thank you guys for that advice. Definitely, to our audience listening, I would definitely heed that. Getting applications earlier definitely means that they're reviewed sooner and you're more likely to get an interview. With that, Tammy, I got one more question for you, and then we'll actually talk about the interview process and timeline so everybody's aware of that. So Tammy, for scholars who are applying to the program, you'll be doing their interviews and kind of looking at resumes. Would it hurt a scholar applicant to include what house they wanted to join or preferred, either Gryffindor or Hufflepuff, or heaven forbid, neither?
Right. No, actually it wouldn't. I think that I have to play both sides of the Hufflepuffs and Gryffindor. So, I'm going to be the even keel person on this. So no, it does not matter which house they prefer. We still have we do this obviously with COVID, it kind of stopped us a little bit, but our IS department are the Slytherins, and our eye clinic is the Ravenclaw. So we've got many houses running around at Church Health, just not dental. But no, it does not affect how they prefer which house. So good question, Alan. You got me on that one.
I'll say it is mysterious how the Sorting Hat chooses at first. No one knows.
Especially with y'all switching halfway through the year.
Us switching halfway through the year is just part of being flexible and adaptable.
All right, so thank you all for that. Did y'all have any other final comments or things you would like to share with the audience?
Hey, Alan, I would just like to thank you for hosting this today. I think it's a great opportunity for people that are interested in the program to actually hear from the scholars that are actually going through it. And I think it's a great opportunity. So I appreciate you putting this together for us.
Oh, yes, most definitely. And thank you guys for taking the time to do this and share kind of what you've been learning and your experience, both as a scholar and a supervisor. With that, we're going to take a minute and talk about the application for everybody. So if you three could just kind of hold on the line in case we get any questions and we can address those. And I'm going to take a second and share my screen. So the Scholar Program, all of our program information can be found on our website. Can people see the screen All right, so yeah, all of our program information can be found on our scholars website, which is churchhealth.org/scholars, and it will take you directly to our about the program page. I'll try not to go zooming through that, but you can find just basic program information on the first page. We'll have future webinars up here as well. You can meet the current cohort, or you can go to our FAQs page, and that'll answer some of the basic and general questions we get about the program a lot. You can meet the current cohort here and see everybody who's part of the current scholar class. You can go look at the program page, which as we have more webinars, we will be posting them up here as well for people to register. And so those will be here. This is today's. And then when you're ready to apply, you can look at the available positions where all the positions and their descriptions are located. And then there's the application page. And so the application page will contain all the requirements for the program. Pretty much our main requirements are we require all candidates to have a 4-year degree by the time the program starts. So if you're graduating in May 2021, program starts in June 2021, so that's perfectly fine. You can get applications in and still go through the interview process. And so like I said, the program will go from June to June. The application is here, and so you'll have 2 forms. The scholar application, you can open it here, and then we recommend really creating your application in a Word document and then uploading it afterwards, or kind of copy and pasting. There's a couple components to that. So we will require an up-to-date resume, and we make those as professional as possible. We really recommend talking to career service offices on your campus and seeing if they can help. We do require a personal statement. This is about, I want to say our max is 800 words, but we really ask you about, why are you wanting to come to Church Health? What are you trying to learn about? And then we also have an essay that's included, and this is more of a critical thinking and ethics. And so we really try to make the application mirror either a medical school or kind of graduate school or going on to a professional school process. And so that way you get the interview, you're practicing creating a personal statement or working on your resume. And those are real things that you just need professionally, either as a student or a professional moving into a career. And so we'll also require 2 letters of recommendation. So there's a link in the scholar application that you can send to either professors, people you've worked with in the past, or you can just click this link. It'll take you to the same place. And you can just send that link to whoever you would like to provide you with a letter of recommendation, and they can just upload it really quickly on their own, and we'll get those and match those to your, or put those with your applications. So under all that, we have our how to apply instructions. We also have our timeline. So the application is now open. The priority deadline, which will be February 15th. So you want to get your application in by February 15th, and then interviews will start being scheduled in early February based on the applications we have at that point. Between February and May, we'll review the applications, and we'll be scheduling interviews with candidates, and then final decisions will be made in early May by May 7th. And so with that, the program will start in June. So as I was saying earlier, program requirements, you're required to have a 4-year degree by the time the program starts. You have to have earned that degree within the past 3 years. So you can be out of school for a couple of years and still apply to the scholars program. And of course, we recommend a GPA of 3.0 or higher. I'd just like to give a quick thank you out to our panelists. Thank you for joining us. Thank you to our audience. Thank you guys so much for making this first webinar a success. And it was good talking to everybody. Thank you all so much.